because we are partnering with a lot of colleagues around across the aisle here at WUCCP. So this is initiative that is co-sponsored by the IPA, the Institute of Public Health, the Global Health Center at Washington University as well, the Climate Change Program, and we are very thrilled to be here today. We have a stellar, special, and wonderful person today, Billy Giles Cortai. I have been a fan of Billy for many, many years, including when I was in my grad studies and I read the 8 volumes of her doctoral dissertation, massive work. And Billy is a professor, a distinguished professor at the VC Professional Fellow and the VC Professional Fellow at RMIT University. And she's been leading for many years, many initiatives around built environment and well-being, and she's a champion for Liveable Cities. And her expertise has not only helped the world to understand how to assess, provide metrics, but especially help inform policies around improving livability in cities. Billy has been a major influencer in a lot of global organizations, WHO, UN Habitat, and different professional organizations. And we are very, very much lucky to have you here today. Especially thank you for enduring your late night there, Billy. And we know it's 10 p.m. and down under now, 10:05, and we appreciate you being here with us. So this is being recorded, but I think we have time for Q&A at the ending. And if you have questions, just send them through the chat. I will try to moderate, but I think we will save some time for questions later. So welcome, Billy. Thank you so much for doing this.
Hello, Rodrigo, and thank you so much for such a lovely, warm welcome. And it's an absolute pleasure to be here, even if it is 10 o'clock. My cat will probably come and grace our company very soon. This is her time, so she'd probably be a bit anxious. Yeah, Rodrigo and I go back a long way. I think I met Rodrigo at a conference. He came to have his photograph taken with me because he'd read my thesis, which is sort of always a big thrill when you've written a thesis and someone has actually read it and knows probably more about it than I did. It's a pleasure to be here. I'm going to share my screen to talk you through my presentation, which I've called Liveable Cities for All. Are we there yet? Here we are. Okay, so yes, I'm at RMIT University and I'm the director of the Healthy Liveable Cities Lab. And we've been working in this space for a little while now. And you might ask yourself the question, why study livability? And I want to introduce you to a colleague of mine. His name's Ian Butterworth, and he was the person who got me involved. I was doing work around the built environment and health, and through his insistence, really, he was the director of public health in a regional office of the health department of Victoria when I first moved to Melbourne in 2011. And prior to me arriving, he asked me if I would be willing to work with him. He'd actually studied at Berkeley and had a built environment and health background. He was very excited I was coming. He was working in the system. He was a policymaker, and he asked me if I would work with him and get involved because the area in which he was managing were growth areas. Melbourne has been growing very rapidly, rapid population growth, 2% a year. Every year, 100,000 houses being built, and that's gone on year. And so it's massive growth for a city to deal with that, in terms of dealing with delivering infrastructure, housing for people. And he asked me to get involved because 4 of the 6 growth areas were in the Northwest region where he was working. And what he did, he got me to go around and interview all the policymakers in the area. So all the regional government department managers, I had to go around and interview them. He paid me. I didn't want to do it because I was way too busy. He got me, and I had to go and interview all the managers of the public health, all the regional government departments. I had to go and interview all the mayors and CEOs of the local government authorities, and some of the director generals of some of the government departments that worked centrally in the city. And he wanted to know how they could contribute to creating population health And when I asked him, you know, what sort of evidence he needed in order to be able to make a difference, I did a little video of it, and this is what he said to me. Oh, am I showing you? Can you hear that?
We need conclusive evidence that shows the relationship between good urban planning and making it easy for people to experience exercise as part of their everyday lives. Not just exercise, but also access to good places, access to healthy food, access to great public transport that's reliable, affordable, frequent, integrated with other forms of transport. We need to make sure that people have got good access to local parks, fresh food outlets, entertainment, leisure, friends and family, or at least transportation options to get there. And that information needs to be taken up not only by health people, but in particular by developers and by people that manage urban planning portfolios.
So you can see I'm arriving. This is 2011. This is a pretty big agenda. Oops. So he wants conclusive evidence. He wants it to be about everything, not just one behaviour. He wants to be, it's got to be applicable to health. It's got to be applicable to all the policymakers that he's trying to influence, government as well as the private sector. So it was a pretty big agenda. But when he was talking about this, and when I went around and interviewed all the local government authorities and all the people working in government departments and senior people in the departments, it became pretty clear to me that what we're talking about here are the social determinants of health. We make decisions about policy, and these are the social determinants of health. And when this is the definition from the World Health Organization Commission on the social determinants of health. And it's the conditions in which people are born, grow, work, live, and age, and the wider forces and systems that shape conditions of daily living. So it's economic policies, it's systems, it's planning, social and planning policies, political systems. These are the social determinants of health. We make decisions all the time, and this determines the conditions in which people live. Now, if I went and talked to the Minister for Transport around the social determinants of health, I can tell you in a heartbeat that immediately the eyes start to glaze over. He looks like he's awake, but no one's at home, not listening to me at all. But in Melbourne, I don't know if you know this, but Melbourne, for many years, the Economist Intelligence Unit ranked Melbourne as one of the most livable cities in the world. Now, that provides a wonderful opportunity to talk to policymakers about the things that they think are important, the livability of the city. But for me to define that in terms of the social determinants of health. So the question that we asked ourselves is, could we reframe the social determinants of health, not talk to them about that, but talk to them about livability, something that they value. And the work I'm going to be presenting to you today is based on a program of work that's gone on for about 10 years actually, and there's a large team of people, so I want to acknowledge everyone in the team. But that was the context for where I started with this. Our starting point was to ask ourselves the question, well, what is livability? People talk about it, people value it. We looked at the definitions of it. No one was really defining it, certainly not in policy terms. Even globally, we talk about livable cities, but no one really defines it. But we decided that we would define it. We looked at all the different types of definitions that were around, and this is the definition that we came up with, which is very inclusive, as you can see. We said that a livable community, according to the literature of all the different definitions, is safe and socially cohesive and inclusive. It has to be environmentally sustainable. The planet is dependent on this. And so it's no point of providing affordable housing, because we need affordable housing. But if that's not linked to public transport, walking and cycling infrastructure, to everything that you need for daily living, to employment, to education, to public open space, to shops, services, leisure and cultural opportunities, then that is not a sustainable way of building our cities. A more sustainable way would be affordable housing with all these amenities nearby. And we thought, well, this is our definition of livability. And we took the view that what gets measured gets done. and that we wanted to ask ourselves the question, are we building livable cities for all? And we started to embark on a whole program of work. Now, I don't know if you've ever seen this paper by Steve Allender, but to me, it was really important paper. This is the title of the paper. Tell us something that we don't already know or do. And it was the response of planning and transport professionals to public health guidance. Steve Allender and Charlie Foster were going around doing these interviews when the NICE, the National Institute for Clinical Excellence, put out public health guidance on the built environment and health. And they went around and asked what the response was. And this is what the planning and transport people said. Tell us something that we don't already know or do. Create walkable environments that's going to encourage people to walk. Well, we know that. What's next? Now, what they said in this article, which is really interesting, is that they really valued the fact, they thought that by health getting involved in this topic, it was really important because it gave their topic that they were trying to achieve credibility and another reason to do it. But it wasn't telling them anything about what to do, how to change anything, what needed to happen to change the way they were designing their cities. And that's what they were telling Steve and Charlie when they did these interviews. So what's really important to me, the take-home message for me, is that if I wanted to have influence, if I wanted to do what Ian Butterworth had suggested, it wasn't enough just to go and do a study that told people what they already knew. Walkable environments create, get people to walk more. That wasn't enough. We had to undertake policy relevant studies that spoke to the people we were trying to influence. And to do that, we needed to understand the policy world we were trying to influence. And so I had a couple of students when I first went to Melbourne. I was very fortunate actually when I went and did these interviews. Ian, in his wisdom, gave me a planner. So he had a planner working for him and she went around with me and did all the interviews. So not only did I hear from all these people what was needed in Melbourne, I had a planner explaining the planning system to me, which was really vital. And again, this idea of working with, cross-disciplinary, she wasn't an academic, she was an actual planner and she was working in the health department at the time. But she came with me and helped me understand what I was hearing. Because, when you are new to a city, all the language is new, it's really hard. You actually need someone to do the interpretation. And so she came with me. But in addition to that, I had two students. One was Melanie Lowe, and she did a PhD looking at integrated planning for healthy communities and looking at Victorian state government policy. And Jeff Brown, he looked at local government, where they were using evidence to inform strategic planning for health and wellbeing. So we had these two policy analysis go on to actually help us understand both the policy world from a state government perspective, and also from a local government perspective. The federal government in Australia doesn't play a huge role in planning in Australia. It's getting a little bit more involved, but more at a strategic level than at the grassroots level. Now, we're academics, of course, so you could argue that this was going to be pretty dry and not very exciting. People say that policy relevant research isn't very exciting. Well, we wanted to create an exciting scientific enterprise, and Hannah Badlin, one of person who was in my team, she led a program of work where we looked at what we called domains of livability, the subdomains of livability. So livability was this big concept and it had to break it down. If we wanted to study it, we needed to break it down into its component parts. We called them domains. We looked at public open space, public transport, which we call transit, the walkability, housing affordability, access to employment, access to a healthy food environment, and whether one of our funding partners wanted to look at the alcohol environment. Having less alcohol was actually more beneficial than having more alcohol. So she did a huge program of studies. So we had a Centre of Research Excellence, and we asked ourselves the question, are the underlying domains of livability associated with health and wellbeing? And we did a whole series of papers. The second part we wanted to do is, it's all very well, we have lots of data on our computers, and that doesn't really get used. What we wanted to do was make it, to visualize it for people, to make the invisible visible. So what we wanted to do was to start mapping all these indicators, things that we found to be associated with health and well-being. So, for example, we looked at Melbourne's walkability, and we knew that people who lived in walkable communities, as Steve Allender said, were more likely to walk. But what they hadn't done before was map it to show where are the walkable communities. And this caused a bit of a stir because we can see that the walkable communities, anything that's green, the dark green is where people are likely to really start to walk. Even a 7 is not very walkable. These are deciles of walkability. Anything white through to pink, people will be driving. You'll recognise this in your own cities, I'm sure, because we have America and Australia share some common attributes, the way we've built our cities. It's only in the green areas that we would see much walking at all. Everything else, well, certainly for walking for transport. And the walkability index is made up of street connectivity, levels of density, and what we call a daily living score, so people's access to shops and services and public transport. We also looked at social infrastructure. Social infrastructure are things like access to schools, access to general practitioners, access to community services, this sort of thing. And we also looked at 16 different types of destinations, different types of social infrastructure. And this is the map. And you see the similar pattern. The people in the inner city are the ones that have most of them, that went up to, the average was 13.9. Different types of destinations. The people out here in the outer suburban areas, they had between 0 and 1.4 access to social infrastructure out here in the pink areas. So hardly any access at all within a walkable catchment. So, well, we didn't just do it in a walkable catchment. We looked at the different types of catchments for different destinations. So a high school has a bigger catchment than a primary school, for example. You travel further to a high school, which is a regional facility. A primary school in Australia is a local facility. So we had different sorts of cut-off thresholds for distances. But you can see on the fringe, people don't have much access to anything, and it sort of matches the walkability. Where you've got more walkable communities, you also have more social infrastructure, very much related. The third question we asked ourselves was, if we had an index of urban livability, we'd had the Economist intelligence unit telling us that Melbourne's very livable. We wanted to map it for a start, and then we wanted to see, was it this whole concept of urban livability, when we put it into an index, is it associated with health and well-being? And Carl Higgs led this work. It was very interesting what he did. He created an index of livability where he brought together all of these domains of livability. He created very sophisticated sort of way, he created soft thresholds. So it wasn't that you had a policy or not, but he created a soft threshold that, even if you don't have it right where it should be, you have it sort of close by, you get some benefits. So he had soft thresholds, very sophisticated. And you can see a similar pattern. The most livable areas, again, in the middle of the city, no surprises here, and in the outer suburban areas, although they're little pockets, which is sort of interesting. Now, these are older suburbs. Dandenong is an older suburb, where they in the old days where they did build nice connected street networks, and where there are shops and services and public transport. So there's some green shoots here, but obviously the inner city is where it's most livable. And we found that when we looked at it, for every unit increase in livability, and what's interesting about this, of course, going back to this, Melbourne's meant to be the most livable city in the world, but it depends where you live. If you live in the inner city where all the executives, what that index is really about is where the executives who travel, the global executives will live. Of course, it's livable, but not when you live on the fringe of the city. There's lots of inequities in the city. And what we found was for every unit increase in livability, the odds of people walking, cycling, or using public transport increased by 10 to 15%. So for every unit increase, so it's quite significant. And for every unit increase in livability, the odds of people driving decreased by 12%. So we're talking a very significant impact on walking, cycling, public transport and driving, which from a sustainability point of view is important. And since then, Carl's looked at cardiometabolic risk factors, which just published a couple of weeks ago, actually, in one of a Nature NJP public urban sustainability. So that's available too if you want to look out for that, but that has cardiometabolic risk factors. And it goes in the expected direction. Now, we did also went national with this. So we're doing most of our work in Victoria, but then we went national. We did the Creating Livable Cities report and we mapped urban policy implementation, because we said, I said about understanding the policy world in which we are living. So what we did was we wanted to map policies. My cat's just decided that this is not a good idea, that I'm working late. And so we looked at policy implementation, and we created a bunch of health-related national livability indicators. What was important about this, we asked the question, do we have the policy and frameworks in place to deliver healthy, livable cities in Australia? Now, I'm not going to show you the detail of this, but the truth of the matter, we don't. I mean, what's interesting for me, what underpins a livable city is a walkable city, and what underpins a walkable neighbourhood is the levels of density. We've got to get densities, and yet we had a policy target of 15 dwellings per hectare. A hectare is 2.5 acres, so that's what a hectare is, 2.47 acres, and so 15 dwellings per hectare is very low density by international standards, and you can see that that's what the policy target was, and even then at the suburb level and at the local government area level, it wasn't even being delivered. So only 21% of suburbs were actually meeting this very low, inadequate policy. And so it's pretty understandable why we were getting very low walkable suburbs, because the heart of it, the densities weren't high enough. And even if we had a really poor policy target, only 21% of suburbs were actually achieving the target. So something's wrong. And that was true of most of the policies that we looked at. This is Melbourne's results, but like, for example, in Perth, it did have a very good, down the bottom here, 26 was the policy, 26 dwellings per hectare was the target. Only 2% of suburbs actually met that target. So that's a new policy for Western Australia. So not surprising that not so many, but it's still pretty low. And so that's the reason why we're not achieving the sort of cities that we want. So we don't have the policy frameworks in place. And then when we map this, so you can actually see this is looking again about our density. So this is the target is 15 dwellings per hectare, and that's going to be in green. And this is the sort of levels of density. 60 dwellings per hectare was still pretty low. You can see across all this map, there's not many places. This is Sydney, only really in the inner city. Perth or Brisbane, really poor levels of density there. Perth, really shocking, and then Melbourne a little bit, but also bad. And then when we looked at the suburbs that were achieving those targets, you can see it's only really in the inner city. Sydney did better than every other city, Melbourne a little bit, but that was the only cities, that's the only places in the city that were achieving these very low levels of density. And so we made a number of recommendations based on this. We said that for Australia, what we needed was evidence-informed policy, that there was plenty of evidence now telling us about how we should be building our cities, giving us some clues about the metrics, and we needed to have evidence-informed policy. We needed to have integrated land use and transport planning, but it needed to be informed by policy. We also encouraged the government to have, or the governments, to have short, medium and long-term targets. So what we found was that a lot of the policies lacked ambition. They would have really low targets. Some cities were achieving them, but they were achieving them because the targets were too low. So they could pat themselves on the back and say, we're doing really well, but they weren't really. They were doing badly because the policy targets weren't high enough. And some cities had very high targets. They looked like they were doing badly, but we wanted to encourage them to have ambition in your policy, try and achieve better outcomes, and have short, medium, long-term targets to achieve those outcomes, rather than to have these targets that were not lacking in ambition. We argued that we thought spatial indicators were important, and they could be used to help cities to benchmark and monitor the implementations of policies. And we suggested that if we really wanted to achieve better outcomes, we needed metropolitan governance. What's happening in Australian cities, I don't know what it's like in the US, but we have lots of little local government authorities, and then there's no, depending on the quality of the leadership, we don't produce good outcomes. We needed to have metropolitan governance that would ensure that there were, to reduce the inequities that we were seeing within the city. These were our recommendations. What was great about it, actually, I was at a meeting where the Minister for Planning was there, And he held up our report. He said, have you seen, he was talking to the development industry. So this is the Minister of Planning talking to the development industry. And he said to them, have you seen this report from RMIT University? We're doing really badly. We're creating inequities in this city. And he went on and gave the big lecture. Couldn't have asked for a better rap than that one. That was very pleased about that. We wanted to make sense of the evidence for policymakers, and so we produced a series of scorecards which actually summarised the findings, and that meant for the 4 cities where we'd done policy analysis in Perth, Brisbane, Melbourne and Sydney, we had scorecards to try and influence policy, and we tried to get those distributed locally. And then we went national. So we've gone national now. We've done this for 21 cities in Australia, and we don't want them to sit out the data to sit on our computers. We wanted to distribute it, make it available for policymakers to use. And so we've created the Australian Urban Observatory, where all of these data, it's an interactive website that people can go in and see the data, go in and interrogate, to go into a city to see what is going on in their city and where the interventions need to be. And for each of the 21 cities, we have scorecards. We also tried to summarise. We'd been, I mentioned that had this exciting program of work. So we summarised all the findings and we put them into we wanted to have evidence-based metrics for our healthy livable cities. And so we created an urban livability checklist. And so what we found through our research is that, for example, dwelling density, unless it was up to more than 25 dwellings per hectare, we wouldn't have a walkable community. People would be driving. So we put that in as one of our desirables, and we wanted to create a checklist that local government, when strategic planners were going through, they could check a development and say, well, what is the densities you're trying? We could give them a score for their the plans that they were reviewing. So we tried to summarize, this is a program of work that we summarized. It wasn't just one study, it was a whole program of studies. We work with our external advocates, and on the left here, that's not a very good image actually, but it's the Healthy Active by Design. It's the Heart Foundation, and we did all the literature reviews for it. So we did one on public open space, on community facilities, on buildings, destinations, etc. So we summarised evidence for the Heart Foundation because it was promoting it for use by local government and planners. And then also we worked with the Planning Institute of Australia to try and get our evidence taken up. We responded to submissions. There's often submissions being called for. So there was one, for example, the federal government was looking at the role of the federal government, the Australian government's role in the development of cities. I said it doesn't have much of a role, but in 2018, it did an inquiry. So we went there and gave evidence, and we talked about what the federal government should be doing to be able to promote health, or to promote better cities that would be healthy and more sustainable. And we did that for all of any time there were submissions opportunities, we used our evidence to put together submissions. So what? Is this important? Well, it's really important if you look at inequities in the city. So this is heart attack data for metropolitan Melbourne. It's a little old now, but it wouldn't have changed very much, I don't think. But this is comparing the top 10 or the bottom 10 low socioeconomic areas with the top, and this is standardized morbidity ratios, and you can see that in the more disadvantaged areas consistently the standardized morbidity ratios are much higher than in the more affluent areas. This is the top 10 local government authorities compared to the bottom 10. So it is important in terms of inequities in the city. We can see it very clearly, and we see it when the distribution of those spatial indicators reflect these poor, will reflect the sort of figures that we're seeing here. In the more disadvantaged areas, they tend to be the least walkable and have the least amenity, and people are not likely to be walking or to be physically active. So is anyone listening? Are we having any impact? Well, we are having impact. I was invited to contribute to Plan Melbourne. This is our Metropolitan Strategic Planning document, and in 2014 and again in 2017, it had a health and wellbeing section in it. I was invited to contribute, and one of the directions is about livable communities and neighbourhoods, and to create neighbourhoods that will support safe, healthy communities and healthy lifestyles. So that was great. Our definition of livability got into the Victorian Public Health and Wellbeing Plan, thanks to the great work of our advocates in Butterworth, who was very keen to get this into the state plan. And it got into the 2015 and 19 plan, and then more recent one as well. So our definition of livability is in there. Now, the reason why that's important, because in Victoria, the local governments need to talk to the state, look at the state government policy to determine how they will, they are required to promote health and wellbeing, to have municipal plans to promote health and wellbeing, and they look to the state plan to inform what they should be thinking about. So it was really important for them to have our definition of livability in there. And to that end, the state government also used our livability work to inform its 20-minute neighbourhood concept. This has become very famous globally now. It's been picked up. The C40 have now got the 15-minute cities. Scotland's picking up the 20-minute neighbourhood. But this concept's becoming quite famous, and it picked up our metrics, you know, a walkable catchment being 800 metres. They recommended to themselves, talked about the fact that we're creating livability scorecards, and that we recommended about having measurable standards, and they recommended to themselves that they should follow our recommendations, which was rather good to have the state government doing that. And they also said that we were developing a livability framework to measure public health and wellbeing, and that they should be thinking about using that as part of the framework for evaluation. Local government, then I mentioned that local government is required to promote health and wellbeing, so it's not surprising then that local government started to use our livability indicators. So here's the Cardinia's livability plan, Moreland, all these different local government authorities started to use our livability indicators. And the federal government, they were a partner on our project. We invited them to be part of it. We wanted to make it as relevant to as many stakeholders as possible. And they've adopted a number of our indicators. Here's the transport one, where they've used our access to public transport. They didn't have that. They actually, all they were measuring previously to us, advocating to them they should use ours, was what levels of public transport use were people using. They didn't ask whether people had access to public transport and if there was a frequent service. So they used it. So that was really great. And they ended up using a number of our indicators. But there's so much more for us to do. I mean, this has been great, but the biggest threat to human health is climate change. And, you know, the situation is dire, and we need to act. The Lancet Commission to 2020 said that climate change is the greatest global health threat facing the world in the 21st century, but it's also the biggest opportunity to redefine social and environmental determinants of health. And it's great to see Joe Biden now pushing this agenda globally. We really need to be acting on climate change. We have a recalcitrant government in Australia, as you know, not through want of trying. But evidence is really important. And I think I've been talking around livability. We said it included social environmental sustainability. It's very much aligned with this agenda. We have a climate emergency. You would have seen, you've been having this in your own country. It's been shocking to watch that. But we have a climate emergency. When I came back from holidays in 2020, a large portion of Australia was on fire. We lost billions of animals, literally. I mean, look at the fear in that koala's eyes. It was just, it makes me almost cry now thinking about it. It was such a visceral experience to go through that. We've had, you know, successive droughts. You know, wildlife loss has been massive. It's been really shocking, and we can see, you know, we see the figures. You know, it's climate, we're warming, our rainfall is declining, and we see these figures very clearly. So we really need to act. This is also in January 2019, 2,000 flying foxes perished in the Victorian heat wave. You know, animals perishing. It's been really quite horrific, and I mentioned that about the destruction and the loss of life of animals in that. And you see that koala, it just is so terrified. What was amazing actually seeing the fires was that these animals were absolutely terrified. They're wild animals. These are not, and they allowed humans to pick them up because they were so fearful and they knew they were being saved. It was really dreadful. And of course, the air quality across our capital cities, you know, that was the fires were in the regional cities, but actually our cities, this is Melbourne, this is from my apartment window. And this is the figures from the World Health Organization said at the time that the air quality in Sydney, and would have been the same in Melbourne, was at the hazardous level. So really, really harmful. And of course, air pollution is increasingly being recognized as a major contributor to cardiovascular disease, chronic respiratory diseases, lung cancer. So these are really serious problems. In Australia, we already have about 3,000 deaths due to air pollution. We don't know what the impacts of all these fires were when we had the whole cities were blanketed in smoke across all of our cities. And of course, now the World Health Organization, this is 2020, has come out with a report saying that we need to bring these agendas together, chronic disease as well as climate change. These agendas need to work in unison together, not one separate to the other, because the solutions are often the same. And we need to be thinking about them we need to be thinking about cities, about our work as working on a system. Slides won't go forward. So just coming back to the original question, livable cities 4, are we there yet? Well, I can definitely say that certainly in Australia, we have a way to go. We have, our cities are growing globally. Our cities are growing, demands for infrastructure are growing. Cities globally contribute to 75% of greenhouse gas emissions, or they contribute 75% of greenhouse gas emission, and the development is harming our habitats and ecosystems. So the issue is big. The planet is warming, we're losing biodiversity, and it's affecting health and well-being of people, the ecosystem, and the planet. So this is a pretty big agenda. And as I watch young people protesting, you know, I'm ashamed of what we've done and the fact that, you know, I feel powerless really to have changed things, because young people are right. If you're a young person listening now, I agree with you. We need to be doing something seriously, and, you know, whatever I can do, I will contribute to that. It's a big agenda, and it's an exciting agenda. It's an important agenda. And I think, you know, for us, for you, if you're listening and you're thinking, where will you go in your career? This is the biggest gig in town, as far as I can see. Helping to address this, helping to create policy relevant evidence that speaks to policymakers, that it's irrefutable. It does what Ian Butterworth said to me many years ago. He wanted conclusive evidence that this was important, but evidence that spoke to policy, that would be picked up by policymakers as well as the development industry. We need that sort of evidence in around cities, around the bigger agendas that bring together chronic disease, climate change, protecting biodiversity. These are all the big issues. So I encourage you to be part of that agenda, and I'll finish there and look forward to your questions.
Thank you
so much. I'm sorry, Johnson. Thank you so much. There's so much information there. I have several questions here, but obviously, let's see what folks have to say. Before doing that, I want to acknowledge, Jonas Johnson for being patient, kind, and super organized to put this together. Thank you so much, Chauncey. I completely forgot to thank you early in the talk today. We are very grateful for the work you have done. So we have a question, Billy. Nazca, Professor Giles Corta, how is the walkability to healthful, sustainable food factored in your analysis?
So what we did was, with the food measure that we had, was people's access to fresh food and supermarkets. So we had 3 variables in our access to healthy food. It wasn't about, I guess what we're trying to promote with our livability work is to have a urban growth boundary that restricts building onto agricultural land to protect agricultural land. But the idea is that for our work, what we were looking at is people's access to supermarkets or healthy food choices. What was interesting was that we found that people had closer access to alcohol outlets than they did to a supermarket. So I think at the time when we first did our first benchmarking, we found that on average in Melbourne, people live within 1.4 kilometres of a supermarket, and that's a driving distance, it's not a walking distance.
Right.
And so the 20-minute neighbourhood is based on which is the new policy. It's the pathway to becoming a livable city, is to try and create a city of villages of 20-minute neighbourhoods, and it's based on an 800-metre buffer. So that's how we bring in food. In a way, the supermarket is the anchor. The supermarket, which has got healthy food choices, healthy food options, is the anchor for the 20-minute neighbourhood, because that's where
Right.
shops and services, other shops and services are as well.
Right. Thank you, Billy. So I have one sort of a reflection and maybe question. So what are the conversations you have had with colleagues on incorporating, carbon neutrality or energy efficiency within, the livability sort of, definition or concept? I know we need to be very precise with the metrics. We don't want to keep the definition so ample that we can't operate. But have you discussed anything about that?
Not really, but I suppose what we're still pushing the idea of achieving the 20-minute neighbourhood because of the impact that will have on walking, cycling, public transport use and driving. You saw the figure: with every unit increase of livability, the odds of people walking increased, and that's in our current, that's building at the rate we are. We saw it's 7 dwellings per hectare, and
Right.
still in that environment, we're still seeing, for every unit increase, we're still seeing this level of walking. So with the 20-minute neighbourhood, they are pushing now in the new policy to for building at least 20 to 25 dwellings per hectare. So what we had recommended, I think there's a new policy coming out in the next couple of weeks. I was involved in I've got to read it for Friday actually, but I haven't read exactly what they've put in there. But I was on for the Victorian Planning Authority, the Precinct Structure Plan Review Committee, and our metrics have gone in there. So they are pushing that now. But we haven't actually assessed that. We're moving into that area. We're starting to do agent-based modelling to be able to measure the environmental impacts as well as the health impacts of these interventions, but we haven't done that. I think for me now, the time has gone beyond the what and the why to the how. And that's where we're trying to move our work now, is to how do we change this? Coming back to that Steve Allender quote, they don't know how to do it either. So what I find my evidence, what I'm trying to do now, is to work out the how, because I just don't see that. I think we can do it in health better because we're quantitative. Transport engineers tend to be quantitative, but the planners are not quantitative at all. So it's quite good that we're trying to help them with those metrics to get it right. And the agent-based modelling work is really great, because then we could test it out to say, well, what if we did this? What would be the impacts, and how can we get to net zero at least, if not neutrality?
Right. Wonderful. I love this take on more action-oriented and how we do this, how we make this happen. So there's another question from Megan here. So what factors were included in our definition of well-being? Was that variable focused on access to healthcare and other related factors, mental health, etc.?
So we used a lot of, mainly behavioural risk factors, so for chronic disease, but we also had some studies that looked at mental health. We had the K6, I think, or the K10, which we measures a measure of psychological well-being. Actually, we had one which was to do with what's the measure? Subjective well-being. So we had subjective well-being, plus we had the K6 and the K10. So we've looked at both of those. We've looked at chronic disease risk factors, and we've also looked at harder health outcomes as well. self-report, and in some cases we've got some studies where we've got objective measures of chronic disease, so objectively measured chronic disease outcomes, cardiometabolic risk factors. So we've got a range of outcomes that we've looked at, which we've regarded as well-being.
Thank you. I think Ross has a question.
I do. I wanted to give the students the first try at it, but Billy, first, thank you. That was a great presentation. I think to me, it illustrates how academic work can merge with improving community health and policy change. And so, you know, too often I think in the academic world, we're kind of stuck in the academic world and it doesn't make it out to real world policy change. So I think that, you know, what you presented, I know it's just a snapshot of your work, but I think it's really a great example for our trainees, especially about how academic work can have an impact. My question was really about the sectors. I wondered about, I thought all the sectors you represented in developing these indices make a lot of sense. The one I think I really wondered about was the justice sector. You know, maybe it's an American thing more than anything, but you know, there's such unequal justice in policing and in how the judicial system works, where it's uneven for people of color and poor people, you know, because in part they don't have the means to navigate the justice system. And that seems like it does have a lot of impact on livability of a city. And I wondered if that ever comes into play, and if so, how would you factor that in?
Yes, it's interesting actually, because we had lots of debates when we're thinking about livability, because you could argue that air quality, I mean, just to give you another example where the debates came, also affects the livability of a city, and it does. But the starting point for us was what creates the conditions that affect, I don't know if this is going to fly with crime, but certainly with air quality. Let me start with that one because that was more top of mind for me. But for air quality, it's an outcome of the way we build our cities, air quality, because if you don't get you know, if you're encouraging driving, you create more air quality, poor air quality. Now, does the same thing apply? I think it does, and I think this is where the debate comes in. It does create a more livable community, but is it the upstream? You know, what creates it? You know, we want to look at the causes of the causes. Now, I often think, you know, that doesn't maybe work for people of color in the US, but in Australia, we have a lot of, you know, youth crime and stuff. But if you live in a neighborhood and there's nothing to do, there's nowhere to walk to, you haven't got any recreation, your parents are out working all day and out of the home. There's a lot of alcohol and drug problems because, you know, people don't have full employment. I mean, that creates the crime, you know, and it does become unlivable. But to me, it's also an outcome of the way we build our cities, particularly in this disadvantaged area. So it's the chicken and the egg issue. I know it's important actually, so I'm not trying to say it's not. But what we were trying to do was look at I suppose the planning side of it. And I guess, you know, even in terms of, you know, natural surveillance, I mean, that's a sort of more upstream determinant, you know, of crime prevention through environmental design. The urban design, you know, creating natural surveillance, that affects crime. So I was thinking of more of a downstream than the upstream, if you understand what I mean by that. You know, if you look at a causal diagram, on the left is the upstream determinants of the things that occur downstream. So I don't know if that's a good answer to you. So it's not that I don't think it's important, but that was the reason why we didn't include it. And I think, you know, at the time it seemed like the right thing to do, but, you know, you can second guess yourself and someone now can go off and do that study to add to it and either disprove me or to add it in.
Yeah, I mean, I think it could be a future iteration of this, because I think there are many parts of the justice system that are very upstream. You know, the way the system's created in the first place, how, you know, even like in the US, the war on drugs from the 1980s on, where it made it easier and easier because of these policies to incarcerate people for minor drug offenses. And we built a prison industry that then needed to be supported. So, but I get what you're saying. I think it is both upstream and downstream, but
yeah, so is it city planning? City planning got a role, because this is around city planning. So does city planning have a role in creating the justice system? It does. How does that work for you?
yeah, it does in the
Right.
US. I mean, because
Yeah.
police departments and judicial systems are very localized here, but that's why I wondered if this is more of a US thing than it would be, because obviously yours is a global application. But anyway, it was good.
I mean, I think what's interesting for me, like, that's just related to this, is that what we find is that the big box, alcohol outlets, which cause so much harm, there are a disproportionate number of them are in disadvantaged areas. And, and often in those areas, there's nothing else for people to do. There's either gambling and alcohol, but no other recreational opportunities. And as a result of that, you get a spiral of crime, domestic violence, a whole range of social problems, which is one of the reasons why I got involved in this work, because that's what these local government CEOs were saying when I went and interviewed them. Like, you could run a stop smoking course if you wanted to, and you could tell people to be physically active, but that's not going to create health and well-being in this area. We've got no jobs. We've got alcohol and drug problems, got nothing for people to do. People don't have any public transport. These are social determinants of health, see? And that's really where I was coming from in conceptualizing what we did as we did, because it was focused on the city planning element of it. But yeah, but all those things like alcohol and gambling, create crime. So very much related. We haven't looked at that strongly enough, I don't think.
So I have a list of people here that wanted to ask things. I'm going in the order here. The next one is Deborah, and then I don't think we have time for all questions. We have only 5 minutes.
I'll try and be quiet and don't talk too much.
Yeah.
Thank you, Rodrigo. No, I'll actually skip it. I'd rather have the students, and I was just going to add more to this conversation, so we can talk on the side later. Billy, thank you for a great presentation.
And
I was just to say, actually, just on that point about, as Priscilla, one of Rodrigo's former students, we did a really nice piece of work thinking about livability in, I think it was from Brazil, wasn't it? So thinking about some of these really upstream determinants from a Brazilian point of view, and that has never been done. We did the work, conceptual work, but we've never done it. So there's an opportunity there for anyone who wants to do some work in South America.
I think the message I'm here, and I think that's an important one. And I'll have to stop here because Victor wants to say a few words before we wrap up. This is a concept that it needs to incorporate contextual factors. You'll have to think about them as well. I think that's an important point, Billy. Thank you. So Victor, you want to say something before we wrap up this piece?
Yeah, thank you so much, Rodrigo, and Billy, thank you so much for a great presentation. I wanted to ask you a quick question, and then I'll go on to the other agenda of promoting some of the activities on the Global Health Center. You talked briefly about heart attacks and also about, obviously, global pollution, two things that are very close to my heart. I'm a cardiologist. And obviously interested in those issues. Have you shown any decrease in any of these outcomes with the planning of the cities and stuff? Any insight that you can provide on that?
We certainly find associations between where you live and you're more with the risk of it rather than necessarily there's been a successful intervention. I haven't been involved in any studies to show successful interventions, but I have seen studies that clearly show that people who live in areas where they are more exposed because they live on a major road, or the way their apartments are designed, they're living on, arterials, they are more exposed to air pollution as a result of that, both air pollution, cardiovascular disease, but also dementia, a whole range of diseases now that's coming out to be associated. And now we're finding, respiratory problems. So children, living in primary school, going to, who are exposed by being in schools or daycare on major arterials are having more respiratory problems. So asthma. So I think, I think there's plenty of evidence coming out now showing it's quite compelling. Where you live matters for these major diseases associated with air pollution.
Yeah, agree. Thank you so much. So I wanted to thank everybody for coming to the meeting today. Thank you, Billy, for a great presentation. As you know, we are about in the middle of Global Health Week, sponsored partially by Global Health Center and other organizations at WashU. And I wanted to briefly say that we have still some activities left. For those of you who may be interested, this afternoon we have a gender equal health presenter Rupa Dat, and sponsored by the Women in Global Health. Tomorrow, thank you. Tomorrow we have Medicine Grand Rounds by Mark Hoffman from Northwestern University, talking about global cardiovascular health in the afternoon.
I think Victor is cutting there. We'll have to wrap in a minute or so. So please please check the program. Really, this was fantastic. We really appreciate. Thank you, Jacaranda, Alex, Jonas Johnson, Smriti, everybody that worked hard to put this together, and especially you, Billy. It's fascinating to follow your work. You are such an inspiration for all of us who are doing, trying to do something on that space of conversation. Thank you so much. It has been wonderful.
Thanks, everyone. Okay. See you then.
Thank you.
Bye.
See you.